The headlines said it plainly. When it came to his health, Hulk Hogan's last days were rough.
His final weeks were horrific and riddled with health bouts. Those are the new headlines today about Hulk Hogan's medical crisis at the end of his life.
From the audience's perspective, Hulk Hogan seemed larger than life. Wrestling looked like a show, a fun, flashy performance. But behind all that was years of accumulative physical stress, the kind your body doesn't just bounce back from.
But a lot of these guys realize this, I have to do this crap every night to myself.
This wasn't just about superficial cuts and bruises. These were real injuries, compounded over time.
I've had some close calls and some rough ones, man. I mean, they all weren't just cookie cutter surgeries. I've had some major issues go down, so.
And when you stack that kind of wear and tear year after year, the damage doesn't just stay in the ring, it follows you for life. And as Hogan got older, the effects of that lifestyle really started to show and to spiral downward.
All I know, the longer you're hurt, the more it changes. I remember I couldn't sit in a chair, and then I couldn't drive a car. And then my biggest thing was when I'd go upstairs and I'd look at my bed, my mindset was, I dread laying down because I know when I lay down, it's gonna hurt so bad and I'm probably gonna wake up with an injury. I'd go to bed and wake up hurt.
Despite all that pain, Hogan managed to stay in character almost to the very end.
And I said, let Hulkamania run wild, brother.
On the surface, he still looked strong. So when the news broke on July 24th, 2025 that he had passed, people were shocked.
When the EMTs were called out, did they say for what? Cardiac arrest.
But that heart attack, that single moment, was really just the final chapter in a story that started decades earlier, in a ring, in a gym, in a life lived under constant pressure. Because being Hulk Hogan wasn't just a job, it was a brand, a character, a spectacle. But the more iconic you become, the harder it is to slow down, especially when people's expectations of you are basically superhuman. The competition gets to your head.
It's going to be the survival of the quickest draw, because once you get on that level, everybody's gunning for you. I don't care what the storyline is.
And in a career like that, intoxicating and cutthroat, the long-term health risks often slide to the wayside. You see it across many professional sports. Even when the red flags start flashing, health starts to feel negotiable, sacrificial.
How much pain are you in right now?
That's kind of funny. Because I had a physical therapist ask me yesterday, if you could be out of pain, or you can have a perfect championship walk, what would you rather have? And I said, I'd rather have the walk. She goes, you're out of your mind. I said, yes, I am.
For a lot of you guys, it feels worth it. So you get swept up in it. And before long, you start to normalize the fact that you're in agony every single day. It becomes part of the deal.
I probably wrestled too long. I didn't get the memo that stuff was fake. And I don't complain about it because, like I was telling Sky, she goes, well, how much pain are you in? I said, well, I'm in pain all the time, but I'm used to it.
This is what happens when your body becomes the price of performance. In this video, we're breaking down the toll Hulk Hogan endured and how years of impact, injury, and pressure pushed his body closer and closer to its breaking point. And while I am acutely aware that there were parts of his life that were inconsistent with my own values, today we're gonna focus on the physical implications only. If you're a returning viewer, do me a solid and give the video a like. If you're new to the channel, welcome. Watch the video first, and if so inclined afterwards, join our army of intelligent interns learning about healthcare at the end. And don't forget to subscribe with notifications so that you can be alerted when I post content related to your health and the world around you. And if you dig what I do and want to support our mission even more, consider becoming a member of the channel. Now, let's see where unbridled Hulkamania can take you. From the outside, Hulk Hogan looked larger than life. Indestructible. But if you could zoom in on the real damage behind the legend, you'd see a body that's been rebuilt piece by piece. It would almost look like dismantling a Hulk Hogan action figure. Every joint, every limb, every internal system replaced, repaired, or scarred by decades of impact. At the start of his career, he was in mint condition. His recovery meter was at 100%, fresh, strong, ready to go. But over the years, that meter would slowly tick down. Let's take a closer look at what decades of pro wrestling really did, head to toe.
Because, wrestling has,
while it's fake,
The injuries are real.
The injuries are real.
Here we go again. So just because the ending is predetermined, and when Howard and I wrestle, everybody knows that Howard's going to beat me with a
That would
sleeper.
be so great.
That just because we know who's going to win, that doesn't mean what happens during the match is fake. Because I've never had a match where I didn't get hurt.
It looked like modern day gladiator theater and are you not entertained kind of thing. But even in something scripted, Hogan's body took a constant beating. And while we often focus on the major blows, it's worth starting with the surface level stuff. The injuries that seem minor, but pile up over time.
Teeth marks of people trying to bite my fingers.
Oh my God.
Had my eye reconstructed a couple times from getting hit in the face. Nose broken 13 times. All these teeth, these fake teeth, have been knocked out 6 times. So it's been a wild ride.
You're telling me. But for the most part, these were painful, but superficial. Nothing that would knock too much off the Hulk doll's health meter. His recovery was still solid. No major joints or bones involved. So these kinds of injuries were usually temporary. A broken nose usually doesn't require surgery, is relatively quick healing, and since it's not weight bearing, doesn't affect daily function too much. Knocked out teeth, annoying, but fixable, especially if you've got money for veneers. And eye reconstruction, well, could have been worse, since he didn't lose sight over it. But even these minor injuries came at a cost. They laid the foundation for something that became a constant in Hogan's life, the normalization of pain. For him, pain wasn't a rarity, it was part of the job. Every match meant dealing with something most people, if you're lucky, may never experience at all. And that's before we even get to the serious stuff. There were plenty of those too, starting with one of the worst injuries of his entire career, and ironically, one of the most iconic moments of his legacy.
Probably the worst injury I had in the ring was at WrestleMania 3. Everybody says Hulk Hogan slammed the 500-pound giant. Well, Andre was having some back issues, and he would either go between 500 and about 650. And when I got under him to slam him and scoop him, once I picked him up here, as you can see, I never had my biceps fixed. But that was the worst injury, to tear both biceps and my back in one shot.
And while it looked like a triumph, behind the scenes, it wrecked his body. Injuries that can leave permanent weakness, nerve damage, and chronic pain. And that wasn't just a one-off. Despite his slower, brawler-based wrestling style, Hogan was known for his high-impact moves. Most notoriously, his signature leg drop, delivered in excess across the decades.
Is there anything in your career that you would go back and change?
I know the leg drop doesn't look like a tough move. Most people don't realize, since I started wrestling in '77, equipment wasn't like it was. It was a 22-foot boxing ring, concrete road that had bumps and holes in it. I mean, it was the most dangerous ring I'd ever been in. So all those years dropping that leg in those rings, you know, with the board sticking up or landing on my tailbone, oh my God, what was that, a rock in the ring?
It might not look like much, but Hogan's signature leg drop was brutal. Not on his opponents, but on him. Every time he landed, the force went straight through his tailbone and lumbar spine, specifically the L4, L5, and L5S1 vertebrae, which are already the most prone to wear and tear in the general population. That kind of repeated vertical impact over hundreds or even thousands of matches leads to disc compression, facet joint damage, and eventually degenerative disc disease. Hogan even said he lost about 3 inches in height, likely from disc collapse. And those shockwaves didn't stop at the spine. Over time, they'd also ripple out to the sacroiliac joints and the hip sockets, contributing to the arthritis that would eventually land him with multiple hip replacements. In fact, over the years, he had over 25 surgeries, including either full or partial replacements of portions of his spine, knees, hips, shoulders, and even his neck.
My body shut down on me about 14 or 15 years ago, and I ended up having like 25, 26 surgeries in a row. 10 back surgeries, had the knees replaced, you know, after this was scoped 5 times, this was scoped 6 times. Finally replaced the hips. Got a bullet hole in my shoulder from a couple bad shoulder surgeries. Had the orbital socket broken a couple times. Nobody gave me the memo that stuff was fake.
That bullet hole in his shoulder, it may be a metaphor, but not an over-exaggeration. It was likely an area of skin and tissue that never properly healed after surgery, about the size of a bullet. Just one of the many signs that his body wasn't bouncing back the way it used to. And that's only counting the parts of him that were still biologically real.
The knees are fake, the hips are fake, the back's full of metal, and part of my face is full of metal.
Oh my God. Hogan wasn't just patched up, he was practically rebuilt. Part man, part machine. He showed Howard Stern the proof in a 2011 interview.
This was 7 months ago.
Oh my God.
What do
That's
you
your
see?
back.
See that
It's
thing
disgusting.
in the corner? That's a battery. Yeah, and I got to get that taken out. The wires go from the battery up the middle of my back to the steel plate they screwed.
Jeez.
One of the consequences of all this spinal trauma was nerve damage. Hogan had a spinal nerve stimulator implanted to manage pain, a device often used when conventional surgeries no longer provide relief. These stimulators work by sending electrical pulses to block pain signals from reaching the brain. In Hogan's case, it didn't change much for his chronic pain, and over time, the nerve damage progressed. Nearly a decade later, he was still dealing with the same problems. In 2023, fellow wrestler Kurt Angle caused a stir when he said Hogan had his back surgery again. He had the nerves cut from his lower body. He can't feel his lower body. He uses his cane to walk around. I thought he was using the cane because he had pain in his back. He doesn't have any pain. He has nothing at all. He can't feel anything. That statement freaked a lot of people out. Is he paralyzed? But Hogan's reps were quick to clear things up. He wasn't. There's a big difference between nerve damage that causes you to lose feeling and full paralysis where you can't move. Hogan could still move, but the nerve damage meant he lost a lot of sensation, making walking hard and forcing him to use a cane. But even though Hogan was mobile, he definitely had mobility issues.
Well, I don't have the movement back. You know, I've a real hard time, just doing normal things. I can't.
From the back, the back being fused?
Yeah, the back and
How many discs are fused?
everything's fused.
While the spinal fusion hardware might limit some movement, it's probably not the main cause. More likely, poor sensation from nerve damage meant he couldn't properly feel the ground or control some muscle movements.
Everything hurts. Like, it's hard to explain. Like, if I'm going to brush my teeth and I'm leaning on the counter brushing my teeth, I can't push away. When I'm done brushing my teeth, I have to lean in like that and then pull back. I can't push like a glass door open. Everything in the gym is short strokes. I can't straighten my arms out. And then it's the same with my knees, my hips, my back, my neck.
The reason he could feel both pain and nothing at all is because different nerves carry different signals. Pain, pressure, and body awareness, or proprioception, and sometimes he may feel pain, but lose the ability to sense pressure or where his body was in space. That mismatch makes movement much harder. Add in the fact that some of the joints he was moving on were running on borrowed time.
The thing is, my knees and my hips are so old now because I had the left knee scoped 3 or 4 times, the right knee scoped 3 or 4 times, then I had them replaced. Then I had the hips replaced, and they're all over 20 years old.
Oh, boy.
You know what I mean? 2 knees and a hip replacement. At WrestleMania 18, I was dragging the Rock around the ring for a half hour.
In his later years, he was still grinding through matches on parts that were at their expiration date. Most implants last 15 to 20 years. Should he have gotten an upgrade? Maybe, but that's the thing. There's always a trade-off. Because even with cutting-edge implants, you're still putting that hardware into a human body. One that just got cut open, broken apart, and stitched back together.
Like you've got an hourglass in your head counting down to 20 years where you're going to have to go through that shit again. Like every operation I've ever had, and I've only had a few, the recovery's a bitch.
No doubt. Average recovery for a hip, around 6 to 12 weeks. Longer if you're an active person trying to restore full athletic performance. Knees, slightly longer, but if it's a total replacement, you're looking at about 6 months to be fully back to baseline, to feel really right. Spine, that's a whole nother level. It can take a year or more, and you still might never feel normal again. Now, imagine doing all that rehab while cameras are on you, fans are waiting, and time is money. So what do a lot of professional athletes, especially aging ones, do? They try to speed things up. Stem cells, PRP, all kinds of regenerative treatments. Hogan said he tried stem cells, hoping they'd jumpstart healing, but didn't feel any difference. At least not with the first rounds, which were done locally in the United States, where treatments are more tightly regulated and doctors tend to be cautious with dosing.
After 3 days, they would call me like 2 weeks later and say, hey, so I feel the same. Then a month later, they call me, feel the same. Then like 3 months later, call me, nothing. So I didn't get anything from it.
I wonder if your body's so beat up that it's just bone on bone everywhere and there's nothing that can be done.
There's so much to heal that it's not even getting to the big things.
Eventually, he went abroad, where the rules are looser. He said he needed a super dose or more frequent dosing. Now, I'm not going to go deep on the risks of being reckless with stem cell therapy, but there is a fine line between treatment and injury. We're talking vascular overload, blood clots, respiratory issues, even tumor formation. The point is, this man was clearly desperate for pain relief, even if he didn't appear to be suffering. Again, his tough guy persona was a 24/7 kind of thing. But in these later years, it became clear that he didn't just have musculoskeletal problems anymore. His whole system was under stress. And while it was a heart attack, not orthopedic failure, that ultimately ended his life, it might have helped set the stage. Long-term orthopedic trauma doesn't just affect your joints, it can quietly increase your cardiac risk too. Chronic inflammation, repeated stress injuries, and reduced mobility can all lead to systemic swelling and inflammation, putting extra pressure on the heart. And even seemingly more distant issues like blood clots that sometimes form in the legs after surgery can still end up affecting the heart if a fragment breaks off and travels there, sometimes leading to complications like bacterial endocarditis. And whether or not he had any direct complication from his countless orthopedic related issues and subsequent surgeries, all of it stacked up on top of extreme muscle mass and a physically punishing lifestyle. That's a recipe for cardiac strain. As the director of sports cardiology at the University of Colorado said in a PBS article, you can exercise a lot and appear healthy on the outside, but not be healthy on the inside. That said, fitness is still one of the most powerful predictors of health and longevity, for sure. Regular exercise is one of the most effective interventions we have for preventing chronic disease, preserving cognitive function, supporting hormonal balance, and even reducing cancer risk. But when it comes to longevity, it's not about chasing extremes. Consistent, moderate movement over decades does more for the heart than constant overload. Still, Hogan believed in the power of training, and it's not like he didn't benefit from it as well. Just a couple years ago, he said, "I'm 69, but I feel like I'm 39. And maybe if it were just the training, he'd be fine. That youthful energy may have masked other deeper stressors on his heart. For example, he had a documented history of atrial fibrillation, or AFib, a condition caused by changes in the heart's tissue or electrical signaling, leading to irregular, often rapid heartbeat that increases the risk of stroke and cardiac arrest. AFib can sometimes be genetic, sometimes related to aging, but it's also been linked to long-term inflammation, high blood pressure, and alcohol, stimulant or steroid use, all of which could have been at play in Hogan's case. And for someone like Hogan, who spent decades on display whilst built like a superhero, people were bound to wonder, what exactly goes into a body like that? Is it even possible without some help? Well, Hogan always had an answer.
And my theme is, if you train, say your prayers, eat your vitamins, and believe in yourself, just like I have done, brother, you can have everything you want out of life. And I'm not ashamed of anything I've done.
Inspiring? Sure. But that's not what people were really asking. They weren't asking about mindset. They were asking about PEDs. And of course, there were rumors.
Well, all you gotta do is take a pill or take a shot in the butt every day to get to look like Hulk Hogan. And basically, I've trained 20 years. I'm 38, 37. I'll be 38 in a couple months. Oh my God, why did I say that? But I've trained 20 years, 2 hours a day to look like I do. But the things that I am not is I'm not a steroid abuser, and I do not use steroids.
But right after denying it, he also explained that he'd occasionally used certain sports therapies, prescription anti-inflammatories, and synthetic male hormones to help recover from injuries.
And that sports therapy involves hours of the ultrasound to get the blood going again, the electric stim to get the nerves going, the deep muscle massage, and prescription drugs, basic anti-inflammatories, a synthetic male hormone, which is a form of a steroid.
A few years later, during the steroid distribution trial against Vince McMahon, Hogan admitted under oath that he'd used anabolic steroids, including testosterone and decadurabolone, during his wrestling career. He called it fairly common in the 80s wrestling world. Later, he'd call it a mistake of youth, a response to the pressure of having to look superhuman every time he stepped in front of the camera. But here's the thing. Your body doesn't care why you did it. All it knows is, my heart. Steroids can enlarge the heart, raise the blood pressure, and thicken the blood, all of which put extra strain on the cardiovascular system. And even if the drug use stops, the long-term damage can linger for years, especially as the body ages. If you want a deeper dive on the risks of steroids, we've covered that in other videos. All you need to know is, Whether it was a short phase or a long-term lifestyle, those choices don't just disappear, they build up. Maybe they were just part of the early career grind, a way to armor up a body for all the hits it had to take in the ring. The problem is, after the career ended, the punishment didn't. His own body was kicking his ass from the inside. And when the pain wouldn't quit, neither did the need for something, anything, to take the edge off.
And none of that stuff worked on my back. I'd had so many surgeries. If I see I'm just barely moving my little finger, I just move my leg that much, I just scream like a wounded animal.
Post-retirement, he found himself stuck in a vicious cycle of surgeries and painkillers. Doctors were trying to help, morphine, muscle relaxants, heavy-duty stuff, but it wasn't enough. So he took matters into his own hands. Hogan had always been known to drink throughout his life.
I keep a case of beer and the boys would hit it before we go to the ring. Made the matches much better.
I mean, a post-match six-pack, probably more than some would consider healthy, but not necessarily out of control. But this was different. This wasn't celebration, it was sedation. After retirement, alcohol became another painkiller. And keep in mind, alcohol, especially in excess, can wreak havoc on cardiovascular health, raising blood pressure, increasing inflammation, and compounding the strain on a heart that may already be struggling. And for all that potential damage, alcohol still wasn't cutting it. Hogan eventually hit a breaking point when neither the self-medication nor the actual medication was working. Then came the final straw.
Doctors are just banging me with these pills and different things, and the thing that stopped me, the thing that shut me down completely, where I said enough's enough, is when they hit me with the fentanyl stuff. They almost killed me with that stuff.
Powerful opioids like morphine or fentanyl can slow heart rate and depress respiration, adding even more strain to an already vulnerable cardiovascular system. So around 2023, he decided to quit both alcohol and prescription meds entirely. He credits CBD with helping him kick the painkillers. He was also using edibles to help him sleep.
You know, I'll wake up after 2 hours and bite 1.5 or something, and it just knocks me out like a baby.
And even then, he keeps it light. Hogan was open about disliking the foggy, anxious feeling that can come with overuse. For him, clarity mattered. And in his final years, he was trying to really prioritize health. And he was finally feeling okay.
The upside is, bro, I'm living a good life. I'm happy. I may not be able to run as good as him or walk as good as you, but at the end of the day, I'm 7 years old. I train every day. I eat great. You know, I hardly ever drink any alcohol at all, you know, and I don't take any pills anymore.
But even when he looked like he was living well on the surface, this was still a man who had normalized pain. There was an undercurrent of agony.
In the morning, just to get me rolling, is 2 cups of coffee and 2 Tylenols, and then that's it. I could probably lose the Tylenols at this point because they don't do much.
Yeah.
But it's just kind of like a habit now.
It was to be expected. It is what it is. That's kind of sad, and that's not a knock on him, it's a knock on the system. A culture where health is sacrificed for performance and pain is treated like background noise. It makes you wonder, what's the cost of building a legend? Can it ever be sustainable? Ultimately, he died on July 24th of a heart attack at the age of 71. And of course, to loved ones and fans, it felt sudden. That kind of loss always does. But it wasn't necessarily random. The official cause of death was acute myocardial infarction, a severe heart attack caused when blood flow to the heart is blocked, usually due to coronary artery disease. In plain terms, the heart muscle didn't get the oxygen it needed. And after everything his body has been through, injuries, surgeries, medications, alcohol, inflammation, this wasn't just a fluke. It was the accumulation of years of wear and tear. The body can only absorb so much before it breaks. And if this wasn't enough, according to the autopsy, Hogan had also been quietly battling chronic lymphocytic leukemia, CLL, a slow progressing blood cancer that affects the white blood cells and weakens the immune system over time. It was never publicly known during his life, and whether he knew it or not, we may never know. Even his daughter, Brooke Hogan, said she was completely unaware.
You know, they're saying, oh, he had leukemia, and I'm like, I saw his blood work every time. One doctor, I quote, said, his blood is like a 25-year-old.
She wondered how something like leukemia could go undetected for so long, especially with all the surgeries, checkups, and blood work he went through over the years. And honestly, she's not wrong to ask. CLL can go unnoticed for years. It's slow and sometimes doesn't show clear symptoms until late. That said, I'm not here to speculate. I don't know all the details. The point is, if the diagnosis was accurate, it likely contributed to some of the signs we did see, like fatigue, shortness of breath, weight loss, and a greater vulnerability to infection in his final months. The relentless physical demand, weight pushing, steroid use, and surgical recovery cycles contributed to long-term degeneration, especially in Hogan's spine and joints. Chronic stress, unresolved inflammation, and repeated surgeries likely contributed to elevated cardiovascular risk and cumulative health strain. And when you add it all up, the back, the hips, the heart, the cancer, this wasn't just one injury, it was a lifetime of impact. Thanks for joining me in this discussion about the physical tolls of a lifetime of unbridled Hulkamania. Be sure to join my intern army and click on your notifications to catch my uploads every Monday morning. And don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. As always, that's been a word from Dr. Chris Rayner, not your everyday ortho, where we see one, do one, teach one.